A disease called silicosis has affected miners for nearly a century. We're not talking about young people. We're talking about people who work in mines. But now it's resurfacing in another industry. CBS News medical contributor Dr. Celine Gounder writes that silicosis is appearing more frequently in countertop fabrication shops across the U.S., specifically those that manufacture engineered quartz. She writes, when workers cut into the material, it produces a harmful dust that settles deep in their lungs. This can cause irreversible stiffening of the lungs, often leading to transplants. California began statewide surveillance of the disease in 2019, and as of early March, the state confirmed more than 500 cases and at least 29 deaths from engineered stone-associated silicosis. Dr. Gounder joins us now. She's a CBS News medical contributor and editor-at-large for public health at KFF Health News. So, doctor, we are hearing about relatively young workers becoming sick, very seriously ill with silicosis. What are doctors seeing?
This is very different from the kind of silicosis we were used to seeing in people who had worked in mines for decades. So usually that they would develop this kind of disease in their 60s. What we are seeing is young people, people in their 30s and 40s who are developing end-stage lung disease, so symptoms like shortness of breath, cough, fatigue is how it starts, but end-stage lung disease where many of them are requiring lung transplants. And a lung transplant is not even a cure because the lung transplant might last you, if you're lucky enough to get one, might last you 8 years or so on average, and then you need another, and then you need another. And so this is really tragic to see this kind of occupational health disease we thought we had figured out in the mining community for the most part, making a resurgence among young people.
It feels like it's preventable. What is the best way to prevent it and who's responsible?
Well, the best way to prevent it is not to be exposed to silica dust. So when you cut this engineered quartz, it's made with silica flour, so very, very fine silica dust, and it's mixed with resins and dyes and various other things to make that pretty pattern on your countertop. Well, the problem is, when you cut that, it releases all of that dust. And the only way to avoid that is to not use that as your countertop at all. And there are alternatives. You have marble, you have granite, and now manufacturers are starting to develop what they call zero or ultra low silica quartz counters. So that is something that consumers can really have a big impact on.
So when people are doing renovations, what should they take into consideration?
Well, look, it's not going to necessarily hurt you in terms of this countertop has now been installed in your kitchen, but the choices you make when you're designing that new kitchen renovation have a real impact. And so ask, is marble or granite an option? And if not, go with one of those ultra low quartz countertops. You could save a life.
Dr. Gounder, thank you.